Hi, everyone. Thank you to those who have joined us thus far. We are going to just take a few seconds to make sure that anybody that plans on joining us has time to hop on, and then we will get started very shortly. Thank you. All right, we will go ahead and get started with today's session. Hello, everyone, and welcome to today's webinar titled Comprehensive Case Management, Meeting the Holistic Needs of Our Students. My name is Emma, and I'll be your moderator for today's session. I am the Assistant Director for the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, or we call it IHEC for short, and I'm very excited to be hosting today's event. Before I hand over the microphone, I have a few little housekeeping items to cover about today's webinar and the GoToWebinar platform. For those of you who may be new to using GoToWebinar, maybe you have some experience with it, I just want to point out a few different things. All attendees will be muted throughout the whole presentation, but that definitely doesn't mean that we don't want you to participate. So on the control panel on the right of your screen, you will see the different panels, and then there is a question panel. If you open up that question box, that's where you can participate. So if you have any questions during, you can feel free to type them in. We will get to them during or at the end of the presentation, so no need to worry there. We'll definitely have time to answer questions. And that question box is also where you will go to input feedback. The presenter may ask for your feedback, ask you some questions, and we would really love and encourage you guys to type in any of your feedback or any of your answers there. So you can use that, utilize it all you'd like, and if you're asking questions there, we'll definitely get to them. So without any further ado, I'd like to introduce today's speaker, Joe Espinoza. Joe currently serves as a case manager for the Office of Student Outreach and Support at the University of Denver, and it's under the Division of Campus Life and Inclusive Excellence. So now I'll hand it over to you, Joe, and thank you so much for today's presentation.
Hello, everyone, and thank you for that introduction. As she mentioned, my name is Joe Espinoza. I currently serve as a case manager. I found my way into this position working in prevention work, actually. I was an intern for the Substance Abuse Mental Health Services Administration and then for the Drug Enforcement Administration, and then worked in housing for a large institution, and now find myself working in case management. So that's just a little bit about how I got here. I just want to acknowledge too that my presentation today is kind of just based off of my perception of what I know of prevention and how it kind of works in my current role. It doesn't necessarily reflect the institution's ideations that I work for now. These are just kind of my own thoughts, is seeing how we can meet the holistic needs of our students. So first off, I want to start a little bit with introductions. So I introduced myself. I would love if you can take a moment to just write in kind of what office you're in, what position you're working for, and maybe a little bit about why you're here today. We'll take a couple minutes to do that, and while you're doing that, you can read over, these are kind of the goals for the presentation today.
Yeah, thank you, Joe. So if all of our attendees could go ahead and open that question box and type in your name and maybe what you do for your institution, that'd be awesome. All right, it looks like we have some responses coming in. We have adult college health, APRNs, we've got some case managers and an admin assistant, associate dean of student success. We have some registered nurses with us.
All right.
Yeah, care manager who provides student resources and referrals out to the community. That's awesome. Cool. Licensed social workers.
Great.
Yeah.
All right. It's good to know, just to kind of see where everyone's coming from and what lens you're coming from into this presentation. So as you can see, I'm going to go over some of the overview, culture of care, proactive education, connect wellness and prevention, talk about medical leave and reentry for that, and then at the end I'll have some time for questions. So as an overview, thinking of why additional student support is needed for student success, I think it's really important just to start with what is case management, and this is the way that I view case management. So I would like to mention the case management position that I work in is a non-clinical administrative case management model. So we are our own office in the Division of Student Affairs. We partner with many people on campus, but I think really focusing on case management, we all know that college can be a difficult transition. It can be really hard to navigate, and simply sharing resources with students during orientation or when they come into our office and ask us questions sometimes isn't enough. So case management was really founded in the field of social work and psychology. It looks differently on every campus. It can be clinical. I said ours is non-clinical. It does require a level of paralevel counseling skills, but I think in a non-clinical position such as mine, it's important to recognize case management is not counseling or therapy. It provides an option for students to discuss issues that they might be dealing with, and it really lets them have access to a case manager who can help share resources. And I think a really important part of that is the follow-up and accountability that students can have. So with that, we deal with crisis, we deal with emergency. Our office recently has started looking at natural disaster response. So that's been interesting when a flood happens or when the hurricanes were happening, working with their admission team to see what students we have that are coming from those areas of the country and proactively reaching out to them to see if they need support, if their family's okay. There was a hurricane going on during our orientation, so we were working with students with canceled flights, seeing how we can get them here. So really trying to be proactive and trying to reduce barriers. So if you see the image on the right, I can see the traditional path of a college student, maybe that isn't familiar with how to navigate the university system. They can be bounced around from office to office. You see how many times they're intersecting with their path. And I think case management and other student support resources can help navigate the complicated labyrinth that higher education can actually be to get them through to the ultimate goal for graduation. So really increasing their self-awareness, their self-advocacy, learning how to create their resilience or increase their resilience through coping skills, and learning how to navigate transition are some of the things that I think about. So in thinking about why case management is needed, in 2000, the first case management position was created at the University of Miami, Ohio. That was the first case management position in higher education. In 2006, it was built into two positions, one in counseling, one in the Dean of Students. And then, of course, in 2007, there was the Virginia Tech shooting. And then in 2008, there was the shooting in Northern Illinois. And so around that time, institutions responded with starting to create more of these case management offices outside of counseling and responding to campus tragedies and looking at threats against the institution of higher education, and taking all that into consideration really comes down to university accountability and somewhat liability. So knowing what universities are doing with the information, and when institutions of higher education gain information, how are they using it? How are they storing it? How are they sharing it to collaboratively work together? To really help students in a sense. So case management can almost be thought of to me as a compass for students. So they work Case managers work across campus in several different areas of the institution when trying to help students, and sometimes outside of the university, working with outside healthcare providers, working with family members, working with community members, whatever it may be. Case managers also, at least in my experience, have access to a lot of student data, as well as document and track students. So it's a solutions-focused approach to assisting students with a wide variety of needs. I know in my role, I work with students on action planning, helping them understand processes of the university. Documentation is extremely important, making sure that I'm documenting things for my office, but also sharing that with other offices that I may be working with. Like I mentioned, having access to that student data, understanding where the student is coming from, looking at advising notes, looking at career notes if they have those, tracking students, making sure I follow up. And I think an important part of case management is resource recommendations. So building the rapport and getting to know the student, but then offering them recommendations of what resources they are, but ultimately building that resilience and letting them make choices on their own. Navigating policy, because we love policy and we love political language, and that can be daunting and confusing for students sometimes, especially when they're first generation students or students that are coming from various backgrounds. Campus collaboration, like I mentioned, we can't do this without campus partners, and then also community collaboration. And so in thinking about how case management relates to alcohol and other drugs, this is data from the National College Health Assessment, and I think the National College Health Assessment and other alcohol and other drug data can really help to inform case managers of a baseline of what students might be struggling with. So this is data for students who reported these factors that are impeding their academic performance, which I think we would argue academic performance is one of the main reasons students are at college or university, at least I would hope so. And so the top factors across the years, as you can see here, from fall 2015 to fall 2018, come down to stress, sleep difficulties, depression, anxiety, and then I also have drug use and alcohol use on there. And you can see this is self-reported by students' perception of what they believe is factors that are affecting their individual academic performance. And so students don't necessarily, from this data, I would say students don't necessarily see drug use or alcohol use as something that's affecting their academic performance, but they're definitely seeing that some of these mental health impacts are affecting their academic performance. And so it's interesting in comparison with data asked on the National College Health Assessment about alcohol and marijuana, where the actual alcohol use, and this is the actual use represented from any time in the last 30 days total. The actual alcohol use hovers around 60%, and actual marijuana use is between the 15 and 20% mark. And so they're using this, but they're not necessarily seeing it as an impediment to their academic success. And then looking at the perceived alcohol usage and the perceived marijuana usage, it's much, much higher. So this is where we get talking into social norms and things like that, where students are actually perceiving such a higher use because they believe everyone is doing it. And then that, of course, such a misperception, it reduces the perception of harm and then can also lead to the increase of use. And then when you combine that with mental health issues that may be occurring at the time, it can be a risk factor for students to start using. And so it's just an interesting caveat there. I think this type of data from the NCHA and other studies can help myth bust, and within case management, like I said, it can help to normalize what may actually be going on. So case managers are aware of this information and know how to access it. And if your campus does the NCHA or does other health surveys, informing case managers of that so they kind of know a general baseline of what students might be going through on campus, and then having that conversation with students. And in thinking about college versus non-college students, the only substances that college students were using more of than their non-college peers are Adderall, alcohol, and then getting drunk and binge drinking. An interesting part of this study, and this is from Monitoring the Future, which surveys students in middle school and high school and then 4 years after high school. And so they split it between college and non-college. For those that went to college, their rates of alcohol use emerged only after high school. So during high school, it was low among those who would later go to college. And this is where I was talking about that perception of college having a higher rates of drinking, where everyone might be drinking. And it could also be a number of different factors. It could be that maybe they were trying really hard in high school to get into college, and then once they got to college, it was more of the culture, or they felt more relaxed doing it, or they were getting closer to that age, peer pressure. There's a number of different factors. The non-medical use of prescription stimulants, in many studies, they talk about how students use it to help them study when they're not prescribed it, which can actually have adverse effects. So it's important in a case management model for case managers to know that, in discussing issues that might be going on and bringing up those questions. If they are using amphetamines, are they prescribed those amphetamines, and are they taking them properly? And in thinking about risk and protective factors, college oftentimes is a protective factor for drug use, and that doesn't always apply with alcohol, though. As you can see, as I mentioned, students who didn't drink in high school are more likely to be drinking in college. This isn't true for all students, but I thought it was an interesting point that they had found. I think this really brings up for case management, the difference between individual and population risk. So case management gives a one-on-one experience with individual risk. It really helps to work with students one-on-one and understand the risks that they might be going through. But the reality is that many students are struggling with similar things and making the realization that it is more of a population risk. So this is where data can come in handy, and working with a prevention service office, or working with an office that might have more student data, because oftentimes if one student's experiencing it, more than likely more students are experiencing that. It really kind of depends on the campus culture, not to say that all students are experiencing the same thing. Individual factors can be associated with multiple problems. So in addressing these type of issues on a college campus, we've probably all heard of this now. It seems like a buzzword at this point, but creating a culture of care. It's important to make sure that students are feeling welcomed and supportive on their campus. And creating a culture of care is not easy. It takes time, it takes effort. Building and sustaining relationships across campus and the community to make sure we're preventing, intervening, and helping students who might be struggling with AOD issues, and of course mental health issues, knowing the intersection of that. Recognizing signs of distress, so teaching about behavioral indicators, and then within those behavioral indicators, what to do when you do recognize something. And you can see on the right there, the culture of care really comes from educating students on student support services, collaborating across departments, developing a bystander culture, which I'll talk a little bit more about, training the campus community, and then creating access to resources, especially when we're thinking about our students from marginalized and minoritized populations who may not have had the same level of access growing up, helping them understand and navigate the health system that we have. And I think it's important to mention documentation. So I have Maxient and Advocate down there. Maxient and Advocate are two popular software systems that are used within Conduct, and they were built really as Conduct systems. I know here at my job, we use Maxient for documenting purposes. Maxient is great for being able to send letters, send texts, being able to document things and have private groups so you can have restricted access. And I know a lot of schools also use Advocate. And I think I mentioned the culture of care really can work to address health equity and inclusive practices. So knowing that many of our healthcare systems weren't built for students who come from marginalized populations, the case manager can be really important to help navigate students through that time. So proactive and preventive education. This is really important because we know studies have told us that 3/4 of all lifetime cases of mental health and substance use disorders begin by age 24. And there's about 5,000 youth under 21 a year that die as a result of underage drinking. And those two statistics fall within our college population. So what are we doing as institutions of higher education and administrators to make sure that we're recognizing some of these things? And when we recognize them, we're doing something about it. So bystander intervention, education, and programming, I think, is really important to make sure that we're educating our community to recognize signs of distress, to recognize symptomology that may be happening in regards to mental health or substance use disorders, or even prior to the onset of a substance use disorder, just substance abuse or substance misuse. So creating a bystander culture, of course, is going to increase referrals for case management offices and really all offices on campus in the Student Affairs Division. And that's going to be an increase in work, but really that just means it's going to increase capacity and hopefully increase staffing and funding as a need for more people to be working on these issues. And it doesn't just happen within the case management office, it just doesn't happen in the prevention office. It should be happening in every office because students are human. And I think sometimes we forget that because they're so focused on student engagement and focused on their academics and what are they going to do after college, but realizing that they are human is an important caveat to remember. So prevention and referral training for faculty and staff. Having faculty and staff understand what prevention is, what it means to college students, and how they can implement prevention into their curriculum, whether that's implementing resources or sharing facts in class and relating it to whatever they may be studying. And then faculty training on referring and resources, whether that's online, whether that's in person. I know faculty, for me, have been particularly hard to work with at times, and trying to help them understand what it is we do and why it's important for them to refer. And so that's an ongoing struggle I think that I've been trying to work on, is helping faculty understand when they need to refer. I know faculty sometimes can be so busy, and at the end of the week or weeks pass and we get referrals for things that happened weeks ago, or at the beginning of the week when we really needed to address it earlier. So helping them understand the importance of referring to case management. And then we can do training all we want. We can do web training, we can do in-person training, but giving them distributed reference materials. So I know here we use a red folder that has our process on it, has behavioral indicators on it, it has a decision tree of like, if this happens, who do you contact, when do you contact them, how things work, just if they have more information. And then of course, always having someone available to talk to faculty or staff if they have any questions. I think one thing that I've noticed that we could be better at just across the nation is student employee training. So thinking of our RAs, thinking of mentors in different programs, thinking of community desk staff members that may be working within residence halls or working within the student centers, working within admission or orientation leaders, training those students, and I know they get a lot of training, but training them to understand some of these indicators as well. I know some institutions have focused on training faculty and staff and trying to keep it out of the students' hands, but helping students be a peer-to-peer support. As administrators, students aren't always going to want to talk to us, and students aren't always going to want to let us know what may be going on with them. So working with the student employees could be important to create that peer-to-peer connection. This is especially true within peer health education offices, peer health coaches, wellness coaches, things like that. But I think it can be everyone's responsibility, and acknowledging it and being able to talk about it could be, I think, could be really proactive for prevention efforts. And so holistic student support, working within case management, I think I mentioned already, students are human. They have multiple dimensions, and it's really important to focus on what's important to them. This comes across my mind a lot, the 8 dimensions of wellness. Whenever I'm working with a student, I'm getting to know them. So like I mentioned before, building that rapport, I use motivational interviewing to build that rapport, really get to know them, get to know kind of how they got here, what their family might be like, what their support system might be like, what they want to do, why they're studying what they're studying, what their values might be, and then always having the conversation about alcohol and other drugs, and then bringing it back to values congruency and how, if they're using at a high rate or if there's concerning things, if there's high risk factors there, how is that relating to what they want to do? And oftentimes that comes across as a conversation of what area of their wellness do they want to focus on? Now, this isn't something I necessarily tell them directly, but thinking about that, we know that good mental health contributes to good physical health and how it's all interconnected. So what area of wellness do they want to focus on during this conversation? I have some students who may be struggling with many things, and based on those struggles, it contributes to risk factors, which contributes to their substance use or substance abuse. And sometimes it's really just trying to figure out what it is they want to focus on. So do they need help intellectually? Are they interested in academic coaching? Are they interested in tutoring? Do they need to go to the Career Center for occupational, to focus on their occupational wellness, looking at what steps they need to take next to try to keep climbing up that staircase of what they're going on? Is it an environmental thing? Do they, are they not in the right environment? Are their surroundings just not helpful for their well-being at that time? Physically, are they taking care of themselves? Are they getting physical activity? But that also goes into diet and nutrition, eating and sleeping. Are those things being taken care of? And if not, can we get them connected to a nutritionist? Can we get them connected to some sort of accountability to make sure that they're getting some sort of physical activity? Do we need to get them connected with disability services if they're having a problem with their physical ability and getting across campus? Spiritual, I think, has come up surprisingly a lot within my time in case management, and more in talking about meaning making and purpose of why they're here and what they want to do. Oftentimes students are, at least in my experience, are in this place where many of them been told what to do throughout their life and haven't had many choices, and college is the first time that they're making choices on their own. And so finding what it is that they want to do, and often that comes with fear within their parental structure, within their family structure. Stepping outside of that box can be scary. So really finding what's going to make them fulfill meaning and purpose in their life. Emotional, understanding emotions and regulating emotions. When it's ignored, oftentimes can be a risk factor to increase use as well. Social isolation can be a risk factor for use. Like, all of these things can be just connected, and when you think about total wellness. So when I say holistic student support, focusing on what's going to be important to the student, I think all of these factors are important, but something might be most important at one time. Financial is always going to be important, I think, as well, because college is expensive and it's not getting any cheaper, especially with the ongoing defunding of education publicly, and then just donorships are harder to get at times, and we are in a tough time. And thinking about going forward, this is the continuum of care from the Institute of Medicine, and how case management ties into this. I'm going to explain a little bit, but it goes across promotion, prevention, treatment, and maintenance. And so it's a comprehensive approach to behavioral health issues, meaning mental health and substance use issues that may be going on. It recognizes multiple opportunities for addressing behavioral health problems. And so promotion is in relation to health promotion, which are strategies that are designed to create environments and conditions that support behavioral health and the ability of individuals to withstand challenges. So promotion strategies reinforce the entire continuum, which is important to note, I think, as well. In prevention, we're going to talk more about, but prevention is things that are delivered prior to the onset of any type of disorder. And these interventions are intended to prevent or reduce the risk of developing an issue or a health problem. Issues such as underage alcohol use, prescription drug misuse and abuse, and illicit drug abuse are some of the things that we can work on preventing. In the treatment area are services that are designed for people who are diagnosed with a substance use or other behavioral health disorder. And then, of course, maintenance is that recovery stage. It's service support for individuals, compliance with long-term treatment and aftercare. And I would even say a lot of maintenance is, I wouldn't say this is necessarily a very linear model. A lot of maintenance can be prevention work, because if someone's already been through it, then you're in that stages of change, trying to prevent the relapse. And so interventions don't always fit neatly into one category if you think about it. Some risk factors like some disorders like substance abuse can be risk factors for other disorders like depression. So it just begs the question, can all treatment be seen as prevention, depending on which way you're looking at it? Focusing a little bit more on prevention, the Institute of Medicine defines prevention in 3 categories as universal, selective, and indicated. Many of you may have already heard of this or be aware of this, but universal preventive interventions are the broadest approach, so taking the general public or the whole population. So in this case, in an institution, it would be all of the students, and looking at what preventive interventions could be most successful and how can we do it in a way that's going to be creating such a broad impact that anyone who is a student is getting that type of intervention. Something to think about for this could be educating physicians who might be working on campus in the health network or the health center, I'm sorry. So physicians who are prescribing prescription drugs, educating them on drug misuse and preventive prescribing practices and having that conversation with students could help to reduce the use of sharing their Adderall medication if that's something that they're doing. Selective interventions focus on individuals or a population subgroup whose risk of developing mental health disorders or substance use disorders is significantly higher than average prior to the diagnosis of a disorder. And it's based on biological, psychological, or social risk factors. In higher education, often selective target populations are looking at fraternity and sorority life members, or looking at athletic members, or members who may be in a close-knit learning community or something of that sort. And so within case management, partnering with those offices, making sure that we're getting referrals in a timely manner and making sure that we are addressing those things either individually or on a population-based level through proactive education and training to the groups, or having them come in for case management meetings and setting up action plans. And then indicated, of course, is high-risk individuals who are identified as having minimal but detectable signs or symptoms. And this is often what we do receive in case management, are students that are coming in based on someone noticing something that might be going on with them, or even they say something. I would say a good number of the students that we do have come in to our office oftentimes already have a diagnosis of a disorder. Some of them do not, though, and working with them to connect them to resources to help them better their overall health, I think, is really the point behind it. Trying to figure out what's best for them moving forward and how we can get them ultimately to graduate. Being at a university, we want to see them be successful here. And sometimes that graduation may not be at the institution that they started at. If it's a hostile environment for them, if they can't succeed at this institution, then we can work on what does it look like to transfer? What does it look like to complete online? Things like that. And sometimes these high-risk individuals that may be coming in before the diagnosis of a disorder may need to think about taking a break, and sometimes they may already have a disorder. So if we're thinking about their health and we're thinking about their well-being, how important that is to their overall success as a student. Students are very, very adamant about trying to complete their degree and trying to be successful and finish in that 4-year plan. We measure our graduation rates nationally off a 6 to 8 year retention rate and graduation rate. Students that I work with want to complete in 4 years, and sometimes they'll do anything even as far as putting their health aside to try to complete in that 4-year time frame. And I understand it is important, especially the financial aspect, because school can be expensive, but helping them understand that sometimes they need a temporary break to focus on their health. And for that, thinking of, we have a voluntary medical leave of absence process and a policy that I can talk with them with. We also have a personal leave of absence and policy and process. And we at the institution I work at, we don't have as many online classes, but I know many institutions do, and sometimes distance learning can be what a student needs if they're back home, or maybe it's just the physical environment that they're in on the campus, and online classes can be helpful for that. And so this is another area where we can focus on health equity. We can work to reduce some of those systematic barriers to access. The hard part about taking the leave of absence, especially if we're thinking about a medical leave, it's looking at the cost of care. So does the individual have access to insurance? Do they know how to navigate their insurance policy? If they're on a student insurance and they leave the university, will their student insurance stay intact? Who do we need to work with to make sure it does? What's going to be the financial impact if they leave school? Will they be charged if they've been given financial aid? How is the funding model going to work? Will their scholarships go on pause, or will they lose their scholarship? And then also creating these processes and policies in a way where we have it accessible in language formats, so different languages, but also lay language in English, to make sure that if students are talking with their parents or their family members who may not be familiar with political language, that they can understand this, and always having someone available that can talk to them about it. And so taking a step forward in a medical leave of absence and reentry, sometimes allowing students the option to take a medical leave of absence to give them time to seek treatment during college with little worry is really important. So in our process, to take a medical leave of absence, a student has the option to consult with a case manager, talk to them about what's going on, and see what the best option might be. If a medical leave of absence is the best option, there's a short application process. We try to make it easy for students, so it's very general information that they're providing with us. And then we do ask for a treating healthcare provider documentation, and that's a little bit more direct, and that's complex too, because then we're abiding not only under FERPA, but we're under HIPAA. So making sure we have a release of information signed so we can work with the provider to get the right information that we need. And once we have their application and we have their documentation, we can review it with our healthcare providers here on campus to make sure that we have all the documentation that we need. And from there, we can go forward with an approval or a denial. If it's a denial, the only denial that I've really ever come across is when a healthcare provider adamantly disagrees that the student should be leaving school based on their diagnosis that they have. And if they are denied, a student does have the right to appeal. I think that's always important. If they feel like they should be leaving, then they have the right to appeal and explain as to why. And then when a student is on a medical leave of absence, having them assigned to a case manager that's going to be reaching out to them and letting them know that they still have someone here at the university, kind of as an anchor point that's here to support them. So if they go back home, if they go into residential treatment, even if they're just still here in the city seeking treatment, whether it's counseling support, whether it's substance abuse support, knowing that they have a case manager that they could come talk to if they're here on campus, that they can call if they're out of state, to have that anchoring to the university. And that case manager is also going to be the one that's going to help them through their reentry. And so when they re-enter from a medical leave of absence, a case manager will reach out to them by email to notify them, to let them know, you know, we recognize that you plan to come back this quarter. We want to make sure that you're going to get registered for classes. So here's your course registration timeline. Here's your advisor information. You know, how can I help be of assistance as you're coming back to the university? Making sure they fill out a reentry form, and within that reentry form, we ask for a plan that they have. So what plan do they have to be successful? What resources are they thinking about using or that they know they're going to use? And again, we ask for healthcare provider documentation, which is more of a summary of their treatment. You know, what have they done while they're gone? Does the provider feel like they are ready to be back in a full academic load, or should they go part-time? Does the provider have any other safety concerns for themselves, for the community? And does the provider recommend any ongoing treatment options? And then again, that's the letter of approval, denial, and appeal. And then case management support during the first term of reentry. So they're still assigned to that case manager when they get back, and they still have that anchoring point while they're back here on campus for any questions that they have, so they can reach out really providing that wraparound support and creating a scaffolding of support to make sure that they don't fall down. We want to make sure that they're successful here. And so with that, we know that many things can happen during college, whether it's mental health or substance use disorders. So we just want to see our students be successful here. And to do that, I think case management is extremely important to work with them one-on-one, but also case management can be informed by prevention data and prevention science, and then also just prevention efforts that might be going on campus. I know I may have talked really fast, but I do want to give some time for questions. So do you all have any questions for me at this time?
Awesome. Thank you so much, Joe. Thanks for sharing your perspectives and experiences and also all of your knowledge. So we all really appreciate it. So
Absolutely.
as we said, we've got some time for questions. So if any of the attendees, if you guys have any questions, feel free to type those into that question box on the control panel, just like you had done when you were giving your feedback. And we have some time to get to those. So feel free to ask those and we'll take a few minutes and wait and see if anybody has any, if anyone come in.
I also want to say too, I have my contact information on the next slide. So if you want to connect with me after, if you have any additional questions, I'm happy to email, set up a phone call, talk to you a little bit more about my experience. And if you have any suggestions, criticisms, anything, I'm also welcome to that.
Awesome, thank you. Yeah, sometimes I know it's easier once people are able to get back into their work and kind of think about how it relates to them and things like that. So thank you very much for sharing that opportunity.
Yep.
All right, we do have a question and I will read that aloud for you and the rest of the group as well. It is, how do you see case management different from a health coach or wellness coach that is a staff professional, non-student?
I've thought about this before. I think case management takes that one-on-one level approach, just as wellness coaching or academic coaching or any type of coaching does within the system. But case management is really that solution-focused approach, really identifying issues that might be going on at that time and addressing them. I know wellness coaching oftentimes is more a little bit holistic in looking at everything that might be going on. And so it's something that I don't have a direct answer to. It's something that I've been talking about more with our health promotion office on campus here, is how their peer model, and then we also have an academic coaching model, how the things that they're doing can better work with our office. So I'm actually going to follow up on that, and I do agree. I think many of the roles do seem similar.
Awesome, thank you. We do have another question. We have someone asking if this information gets communicated to the health center and or providers through a system like electronic medical record, for example.
Yeah, I don't know if I mentioned that. So as far as documentation and things like that, the health center does have access to it. It's through a restricted access group. Through, like I mentioned, we use Maxient. And so we have a secure encrypted upload database that providers have access to, and they can upload it to us. And then from there, we share that within our health center. So it's all protected by multiple levels of security. And so we do share it with our health center, and then the providers have access through that system, and then providers have direct access to our case managers just based on us reaching out to them and working with them directly.
Awesome, thank you guys for the questions and thank you for the answers as well. We do definitely have a few minutes left, so if anybody has any more, feel free to keep typing those in, and I'll take this time to again, thank you, Joe, for your presentation. I really appreciate it, and thank you to the attendees as well that have joined us for today's session. Thank you very much, and if you guys could please keep an eye out for an email from GoToWebinar about an hour after the session ends. and it will have an evaluation link in there. So you can copy and paste the link into your internet browser and take that evaluation for us. That really helps us plan for future events. So we'd really appreciate that. Thank you.
Awesome. Well,
Yeah.
my information is there on the screen. If any of you have any other questions, just feel free to contact me. I'm happy to talk to you. I think it's important to acknowledge I'm not an expert in this subject. I think we're all continuously learning. And so that's something to be important to recognize.
And we do have one more question. What credentialing is required for charting the case management notes?
So we don't directly do charting. So our system is separate. We're not within the health center. We're HIPAA compliant as far as we're protecting the patient information that's shared with us. But when we send it over to our health center, they're the ones who encrypt it within their electronic medical records, and they follow HIPAA compliance in that sense. We're really just the administrative portion of that. So the charting is really based on what they might be doing within the health center, but that's something that I'm not exactly sure how they do it.
Awesome, thank you. All right, well, if that's seems like all we've gotten, so I want to thank everybody again, and you see Joe's contact information up there, and you can also reach out to IHEC if you have any questions, and we can kind of help you get to the appropriate channel that you need as well, so feel free to do that. And I want to thank you, Joe, again, and thank all of the attendees for today's session.
Thank you.
Yeah, I hope everyone has a good day.
Yep, you too. Thank you.
Yep, thanks, bye.
Bye.